Okay, part 2. Sorry, my video got cut off. From the CNN news says that the reason why West Africa has more outbreaks than the USA because West Africa, they get their food from bush food. So that's why, and also the virus, the Ebola virus, come from mostly from animals. So he also said that there's no there's no cure for the Ebola virus, and also FDA approved and vaccine or medicine, there's none of that. The only thing is when you develop the symptoms, when you have the virus, all they can do is to isolate you, and also they do maintain your blood pressure, and also they give you an IV to balance your amount of your body salt, electrolytes, and they also provide you with extra oxygen if needed, and also treating coexisting infections and preventing other infection from occurring. And this all depends on the patient's immune system. So once after you recover from the Ebola virus, the Ebola depends on good supporting care, like I said, the care and their immune system. And also, once you get that Ebola virus, you will develop an antibody that will last 10 years or longer. But it's not known if people who recover from it, they are immune to it for life, or they may become infected from a different strain of the Ebola. And some people who are recovered from this Ebola virus, they have permanent complications like joint, and they also have a vision problem. And like the CNN news said, preventing this virus is to avoid physical contact with people showing the signs and symptoms, avoid shaking hands with people who also show symptoms of the virus. And it says, since the virus mostly comes from animals, avoid dead animals, avoid eating dead animals obviously, and keep away from bats and monkeys. Also avoid eating bush meats, bush foods, and especially cook your food very well. And most importantly, always wash your hand with soap before, after coming from the hospital, or after any activities. Future plans: there are currently no licensed Ebola vaccine, but 2 potential candidates are undergoing evaluation. So I tried to search on the undergoing evaluation for the 2 vaccine, but I can't really find any information on that. So it says hopefully they will develop the vaccine that will at least treat the virus, not necessarily cure it. So yeah, and that concludes my presentation. Thank you.